Welcome to the deep dive. Today we're zeroing in on something that trips a lot of people up, the shoulder.
Mhm.
I mean, chances are you've either felt that twinge yourself or know someone who's constantly complaining about theirs.
Oh, absolutely. It's incredibly common.
So we've gathered insights from, various experts. We're looking at everything from that immediate, ouch, what do I do right now
Yeah.
moment
hmm
to figuring out if it's serious, the difference between maybe a strain and a tear, and even which exercises help and which, well, definitely don't.
Exactly. Our goal is pretty simple. Cut through the confusion, give you practical knowledge you can actually use when, your shoulder decides to act up.
All right, let's dive in. So picture this. You've just done something, reached weirdly, lifted wrong, and boom, short of pain. What's the absolute first thing you should be thinking about? Our
Mhm.
sources kept coming back to this price thing.
That's right, price. It's the go-to for acute injuries, those sudden ones. It stands for protection, rest, ice, compression, and elevation. Simple acronym, but each part's important in those first critical hours.
Okay, let's break that down. Protection, that sounds obvious, like stop doing the thing that hurt.
Right, stop the activity, but it also means actively protecting it, especially in the first, say, 48 hours. That's where a sling comes in handy.
A sling, even if you don't have a proper one.
Yeah, I mean, ideally a medical sling is best, but if you're caught out, even a scarf or a towel can work in a pinch. The main idea is just to limit movement, give it a real break.
That's actually a really useful tip. Okay, so P is protection. R is rest. Easy enough.
Pretty much.
Yeah.
Avoid the sport or activity that caused it for at least 48 hours. But the total rest time, that really varies depending on how bad it is. You'd want a professional to weigh in on that eventually.
Right, makes sense. Okay, ice. Everyone reaches for the ice pack. What's the best practice here?
Ice is great for pain and swelling initially. The usual advice is 20 minutes on, then at least an hour off, repeating that cycle for the first day or two. Crushed ice is good because it conforms better.
And wrap it.
Yeah.
Right, don't
Yeah.
put it straight on the skin.
Oh, definitely. Always use a damp towel or cloth between the ice and your skin. Prevents ice burn.
Good reminder. Okay, so PRIC and E, compression and elevation. Are these as big a deal for shoulders?
Not so much. Compression is just physically hard to do well on a shoulder. Getting a bandage to provide even pressure and stay put, it's tricky.
Okay.
And elevation, well, your shoulder's usually above your heart anyway when you're sitting or standing, so it's often not necessary.
So for a fresh injury, it's really about protect, rest, ice. That's the focus for the first couple of days.
Pretty much, yeah. That initial 48 hours is key for managing that acute phase.
But how do you know if it's just a minor thing you can handle at home or if it's something more? When do you actually need to call a doctor?
That's a crucial point. There are definitely warning signs if the pain is just relentless and intense, or if you've got serious stiffness or pain that really stops you moving your arm normally,
Okay.
or any weakness, numbness, tingling down the arm, or if your range of motion is just shot. Those are all signals to get it checked out.
What about like a dramatic moment? You hear a pop or something.
Yes, if you felt or heard an actual pop or a tearing feeling and then you suddenly couldn't use your arm properly, like you just can't lift it, that needs immediate medical attention. Same if the joint looks deformed, misshapen, or there's major swelling.
Right. Don't tough that out.
Definitely not.
Mm.
And, even if it's not dramatic, but you've had pain for months, you've tried resting it, modifying things, and it's just not getting better, time to see a specialist.
And I guess a bad fall or direct hit changes the game too.
Oh, absolutely. Any significant trauma, you're worried about fractures, dislocations, that's an emergency room situation. Better safe than sorry.
Okay, let's shift gears a bit.
Hmm.
What about shoulder pain that doesn't come from one specific event? That kind of gradual creeping pain, overuse injuries.
Right, very common. You start a new workout, a new job, whatever, and your shoulder just gets sore. Often that kind of general soreness will settle down with some simple stuff.
Like what? More ice?
Yeah, rest, ice, maybe 15, 20 minutes a few times a day. Gentle stretching is important too. Just keep things moving.
Yeah.
And over-the-counter pain relievers can help: acetaminophen, ibuprofen, naproxen, that sort of thing.
Ibuprofen. Okay.
Some people find alternating ice and heat helpful too, especially if there's muscle tightness involved.
But overuse isn't always just simple soreness, is it? It can lead to specific problems.
Exactly. If that overuse continues or it's more intense, you can run into things like bursitis, that's inflammation of those little cushion sacs in the joint,
Ah, bursitis. Heard of that.
or shoulder impingement. That's where tendons get pinched, basically, often when you lift your arm. Then you've got more serious possibilities like frozen shoulder, actual rotator cuff tears developing over time, or even shoulder arthritis from wear and tear.
Frozen shoulder, that sounds nasty. What's actually happening there?
Yeah, it's pretty debilitating. The capsule, the tissue around the joint, literally thickens and tightens up. It can happen after inflammation, maybe being immobile for a long time after surgery or illness, sometimes even minor trauma.
Who gets that?
It seems to be more common in women, and people with diabetes or thyroid issues have a higher risk. The good news is it usually gets better eventually, but it takes time, education, and crucially specific exercises. Sometimes steroid injections help calm things down too.
Okay, let's really dig into the rotator cuff now. We hear rotator cuff injury all the time. Strain versus tear. What's the core difference?
Okay, so the rotator cuff, it's not just one thing. It's a group of 4 muscles and their tendons. Super important for keeping your shoulder stable, but also letting it move freely. A strain is basically stretching one of those muscles or tendons too far.
Like pulling a muscle.
Pretty much, yeah.
Huh?
You overdid it lifting, reaching, whatever. You'll feel pain, tenderness, especially when you try to lift your arm up or reach behind you.
And a tear.
A tear is more serious. It's an actual rip in the tendon tissue. The most common one to tear is the supraspinatus tendon. That's one of the main ones for lifting your arm out to the side.
Can tears be small or big?
Yes. They range from tiny partial tears to complete full thickness tears where the tendon is completely severed.
Wow. Do the symptoms feel different?
They can overlap with the strain pain, tenderness are usually there, but with a tear, you might also notice distinct weakness, like you really struggle to lift your arm against gravity. Sometimes people describe a crackling feeling too when they move.
And how it happens matters. Like a fall versus gradual wear.
Definitely. A tear from a sudden fall often causes immediate sharp pain and obvious weakness. But tears from overuse, from wear and tear over time, they might develop much more slowly, with gradually increasing pain.
You know, one source said something really surprising, that over half of people with rotator cuff tears might not even have symptoms at first.
Isn't that wild? It's true. You could be walking around with a tear and not know it. It really shows that pain isn't always a perfect indicator of the underlying structure.
Yeah, that's kind of mind-blowing. So what causes these rotator cuff issues in the first place? What puts you at risk?
Well, repetitive overhead stuff is a big one. Think throwing athletes, swimmers, but also jobs like painting, carpentry, electrical work, anything where your arms are up a lot.
Makes sense.
Then there are the acute injuries we mentioned, falls, lifting something way too heavy, and just getting older.
Ah, the joys of aging.
Yeah. Blood flow to the tendons can decrease as we age, making them a bit more vulnerable. Also, things like high blood pressure, type 2 diabetes, even smoking, they can impact tendon health too.
And age itself is a major factor for tears, right?
Huge factor. Risk goes up significantly with age. Rotator cuff tears are most common in people over 60. Occupation, certain sports, baseball, tennis, weightlifting, and even family history can play a role too.
Okay, so let's say someone thinks they might have a rotator cuff issue, maybe a strain or a mild tear. What can they do at home besides just resting?
Gentle movement is actually really key here. You don't want the shoulder to totally seize up. Things like pendulum swings, leaning over, letting the arm hang and swing gently, and other very light stretches throughout the day are good, but stop if it hurts.
What about the sling? We talked about slings for acute injuries.
Right, for that very initial protection phase maybe. But for ongoing rotator cuff management, you generally want to avoid being in a sling for long periods. It encourages stiffness. Movement, gentle movement is usually better.
Okay, good distinction. And ice and heat, same rules as before.
Pretty much. Ice for the first few days, 10-20 minutes, a couple of times a day, especially if there's swelling or acute pain. Use that cloth barrier. After 2-3 days, if the swelling's down, heat can feel nice for tight muscles.
And listen to your body. Avoid painful activities.
Absolutely fundamental. Don't push through sharp pain. Over-the-counter pain meds can help manage things too, of course.
Got it. Are there any specific red flag symptoms for rotator cuff problems that mean call the doctor NW?
Yes, definitely. If you have really severe pain you can't manage or you genuinely cannot move your shoulder or arm, any numbness or tingling down the arm or in the hand,
Okay.
or if your arm or hand feels cold or looks pale compared to the other side that suggests circulation might be compromised, that's urgent.
Right, circulation issues are serious.
Also, if the pain is just getting progressively worse despite home care, or you notice new or significantly increased swelling, or things just aren't improving as you'd expect over time, time to make that call.
Okay, so assuming it's not an emergency, but home care isn't quite cutting it, what comes next?
Yeah.
What are the main treatment paths?
Physical therapy, that's really the cornerstone for most rotator cuff issues, both strains and many tears. A good PT program works on strengthening the supporting muscles, improving flexibility and mechanics, and promoting healing.
And PT can actually help heal tears, not just manage symptoms.
For many partial tears and even some full thickness tears, yes, studies show a good couple of months of consistent PT can lead to significant improvement, potentially avoiding surgery. It's really
It's,
effective.
that's really encouraging.
What else? Activity modification is huge. Learning how to move differently, avoiding those painful overhead motions, lifting smarter, like keeping heavy things closer to your body and below shoulder height.
Makes sense.
Mm.
What about medication or shots?
If pain is really bad, a doctor might prescribe stronger pain relief or consider a corticosteroid injection into the shoulder. That can powerfully reduce inflammation and pain, often helping you tolerate PT better.
And surgery. When does that come into play?
Surgery is usually reserved for larger, complete tears, especially in younger, active people or those whose jobs or sports really require full shoulder function, or if conservative treatment like PT just hasn't worked after several months.
And you mentioned posture earlier. Seems simple, but does it help?
It really can. Poor posture, slouching, letting your shoulders round forward puts extra strain on everything. Sitting up straight, standing tall, letting your arms hang naturally, maybe using a lumbar support when sitting. It all contributes to better shoulder mechanics.
It's all connected. Now, the exercises. This is key for recovery. What are some good exercises for rotator cuff rehab? The best bets.
Okay, some common recommendations include things like the doorway stretch, great for opening up the chest in front of the shoulder, high to low rows, usually with resistance bands, focusing on pulling the shoulder blades back and down.
Okay, rowing.
Reverse flies using very light weights, again focusing on the muscles between the shoulder blades, but making sure not to lift the arms higher than shoulder level. And something called the lawnmower pull, again with a band, mimicking that diagonal pulling motion.
Got it. Gentle, controlled movements focusing on posture and back muscles. What about the exercises to absolutely avoid during recovery? The worst offenders.
Yeah, definitely some no-goes. Anything involving heavy overhead lifting is usually out. Also, lat pull-downs behind the neck that puts the shoulder in a really vulnerable position.
Yeah, I've heard that one's bad.
Upright rows, where you pull a weight straight up towards your chin, high risk for pinching tendons. And bench dips, the kind where your hands are behind you on a bench that internally rotates the shoulder in a way that can really aggravate the rotator cuff.
Okay, super helpful list of do's and don'ts there. Finally, how do doctors figure out for sure if it is a rotator cuff tear, especially with those sneaky asymptomatic ones?
Well, an orthopedic specialist is usually the one diagnosing shoulder pain. They'll do a physical exam, ask about your history, and consider all the possibilities, not just rotator cuff, but maybe labral tears like a SLAP tear, tendonitis, arthritis, bursitis.
So it's not always the rotator cuff.
Exactly. Then imaging comes in. They'll usually start with an x-ray, mostly to check the bones, rule out fractures or significant arthritis.
Okay.
But to actually see the rotator cuff tendons and other soft tissues, you need either an MRI or an ultrasound. An MRI gives a really detailed picture, showing if there's a tear, how big it is, where it is, and even the quality of the muscle tissue. Ultrasound can also be very effective in skilled hands.
So MRI or ultrasound for the final verdict on soft tissues.
Got it. All right, so wrapping things up on our shoulder deep dive. The big takeaways seem to be: know that price principle for immediate care. Recognize those red flags for when to seek help urgently. Understand that strain versus tear distinction for the rotator cuff.
And the importance of gentle movement, smart home care, and avoiding those aggravating activities and exercises. Right. And that PT is often really effective even for tears, but sometimes injections or surgery are needed. Plus, don't underestimate good posture.
Exactly. It's about being informed, listening to your body, and not hesitating to get professional help when things aren't right.
So here's a final thought to leave you with. Given how incredibly common shoulder issues become, especially with age or certain jobs and hobbies, what small proactive things could you maybe start doing now, today, to support your shoulder health long term? Even if you feel perfectly fine right now, something to definitely mull over for keeping yourself moving well in the future. Thanks for joining us on The Deep Dive.